Hello, good day. Welcome back to yet another episode of Beyond the Stethoscope, where we invite and have discussion with medical providers, mostly not about hospital setting or disease, but about their personal and professional life. And today we are together with another vibrant medical health provider, Doctor of Optometry. Please, Doctor.
Good day, distinguished ladies and gentlemen. My name is Dr. Ismail, and I am a doctor of optometry. I graduated from Biden University, Kano, and I worked with the Federal University Teaching Hospital. It is an honor to be here. Thank you.
Thank you, Doctor. So I will start my question by asking what are the most frequent questions do people ask you?
Thank you very much for asking this question. The most frequent question people ask me is, what is the difference between an optometrist with ophthalmologist and optician? So this is the most frequent questions I actually come across.
Okay, and give us what are the differences?
Okay, so the difference between an ophthalmologist and a doctor of optometry and optician is that an ophthalmologist is a medical doctor. Before you attain ophthalmology, you will have to pass through medical school. After finishing your 6 years in the medical school, you will be graduated as a medical doctor, and after then you will go further to do your residency in ophthalmology. After you finish your residency and you are being inducted as a fellow, then you become a certified ophthalmologist. An ophthalmologist is an eye care provider that provides a comprehensive eye examination, do surgeries, and anything that has to do with the eye. So that is for the ophthalmologist. While in the case of the doctor of optometry, for you to attain doctor of optometry, you will have to go into optometry school, where you are going to spend your 6 years, both preclinical and the clinical years. That is 3 in the preclinical session and another 3 in your clinical session. And after you finished your studies, you are going to be graduated as a doctor of optometry. And a doctor of optometry is a primary eye care provider that is autonomous. They can make prescription, they can do refraction, and they can provide all the necessary eye care services aside surgery. While in the case of the opticians are those the technicians in the eye care team. They work with the ophthalmologist and the optometrist. After an ophthalmologist or an optometrist do a refraction and make a prescription to the patient, he sends the prescription to the optician. The optician is the person that knows how to cut the glasses and to make it a finished product so that the patient can actually make use of. So I think with this, we are quite satisfied with the difference between the two.
Beautiful. I am sure even the listeners now understand the differences. Okay, so what are the most frequent diseases of the eye you used to see?
Regarding the most frequent eye disease we normally used to see in the clinic, mostly it's actually bacterial conjunctivitis, allergic conjunctivitis, and the refractive error. Yes, even though glaucoma and cataract are also quite frequent and common.
Okay, so among these, the commonest diseases you used to see in the clinic, which one do you think people need to be more aware of because of maybe lack of awareness cause misconception or self-management that lead to more complication? Which one do you think people need to know more about and why?
I think among the most common eye diseases we normally used to encounter in the clinic, I think glaucoma is one of the deadliest because it is the reason why it is actually being called the silent theft of the eye, because it keeps on eating the optic nerve, that is the wire that connects the eyes to the brain. And without that wire, there is no going to be transmission of information from the eyes to the brain. And lastly, you will become blind. And when it actually starts to happen, it doesn't come with like observable changes in the eyes. It is painless and it keep on affecting the eyes. And a lot of people, especially those that are from the age of 40 and above, used to come to the clinic with a lot of these problems, glaucoma, without even them knowing that they actually have the glaucoma. Most of the times, they come to realize that they are actually having defective vision when their vision is like already deteriorated. Maybe you can see actually a patient coming to your clinic with something like 636 or 660. You come and tell you, and you will come to the clinic and tell you that, "Hey, doctor, I can actually see far." When you ask him, since when have you started to experience it? They're telling you, last 3 months or 4 months, maybe I went to the chemist, they give you an eye drop. And unfortunately enough, that eye drop can be a steroid, which is also another contraindicated eye drop that can facilitate the aggravation of that glaucoma, because it can rise up to the IOP and things like that. So that mismanagement can also lead to the further deterioration of the eyes, affecting the eyes further. And another thing about it is that glaucoma, whenever it actually starts affecting the optic nerve, or whatever damage it does to the eye, there is nothing like reversing it back. When the optic nerves are gone, they are gone. The only thing we can do is management. So this is one of our nightmares when it actually comes to eye care in glaucoma. That's the reason why we keep on creating awareness, orientation on why people should actually visit eye clinics, and whenever they experience any changes in their eyes, they should contact the professional, because this glaucoma might be happening to their eyes without them knowing. But if we are able to make a diagnosis, know that yes, you're actually having glaucoma at an early stage, with medications and little invasive surgical procedures, you can live your life without having any further complication. So that's it. Thank you.
So, doctor, it is a debilitating situation and heartbreaking for someone to just wake up and realize he can never see again. So, which patient gave you the most heartbreaking situation, and how did you handle that patient?
Okay. Yes, there is actually a patient that came to me, and just like I told you, it's actually the same glaucoma. So that patient have actually been passing through the nightmare of the glaucoma for quite a long period of time. And the issue of like financial buoyancy is something very important, because when you're actually having glaucoma, you have to keep on using your medication, possibly for the rest of your life. You understand? So, and these medications are quite very expensive. Not everyone can actually afford it. And with the current economical situation we are having in this country, a lot of people find it challenging to even eat 2 or 3 times a day, talk less of getting a medication. So that patient, he was actually having a quite, his vision wasn't that very deteriorated, but after a month, we actually gave him an appointment to come back. So the subsequent month that he was actually supposed to come back, he was unable to make it because of a financial challenge, and nobody knows about it. Until 2 months after, can you imagine that patient came to the clinic with somebody escorting him? His vision has already gone worst. I think his vision is not better than handing of at 3 meters. And before he actually left, in less than 2 months, he can walk around comfortably, he can even drive. But within 2 months, the vision got so bad. You understand? And another thing that like makes me feel emotional was that he's actually a family man. His family depends on him. So how is he going to provide for the family? as you can see, the vision has already affected his productivity, his visibility, and his independence. So it was quite very touching. And unfortunately, there was nothing we could do with it because the vision has gone. So that is the reason why most of the times, whenever we actually see a patient that is having glaucoma, we normally used to sit them down, counsel them, educate them, and try to communicate with their relatives. You understand? Because sometimes you can actually get a woman who is just a wife. So, and then she might fully rely on the husband, on what he provides. You understand? So sometimes you will have to like educate and counsel the husband on the effects of negligence if she is unable to get her medication or use the medication. You understand? Because sometimes she can actually just go in, tell the husband, and you just feel like, you have actually been using this medication. If you don't use it for like 2 or 3 weeks, you're not going to make any changes. Or you have been making use of this medication and there is no improvement. So why not stop? So you can't actually stop the medication unless you are going to do that. So it is actually quite very important.
Okay, so for the sake of listeners, can you tell us few frequent early signs and symptoms of glaucoma, and at what phase should people go for eye checkup?
So most of the most important sign of that glaucoma is blurry vision. It actually starts to affect your peripheral vision. That is the way you actually see from sights. You understand? It is actually going to start affecting your side vision small before it affects your central vision last. You understand? So in some individuals, they can actually come up with as mild as itchy eyes, or frequent nudity, or red eyes, or pain. You understand? So there is no specification to what symptom it can actually present to the patient. So that is the reason why it is very important. Whenever you feel any changes in your eyes, as small as itching, go and contact an eye care provider. Because by doing that, he or she will be able to give you a comprehensive eye checkup to know that yes, is this itching being caused by this ear allergy, or is it associated to a bigger condition such like glaucoma or so. And if that is the case, what is the best things to help prevent further deterioration of the vision or the condition. So this is why it is very important you attend eye hospitals whenever you actually feel any changes in your eyes or your vision.
So, doctor, how do you end up being a doctor of optometry? Was it your wish or is an accidental?
I think it's actually good. Yes. Because, I actually have a kind of curious mind. Whenever I actually see anything new or anything that I don't know, I will actually try to see and know more about it. Uh, After I actually graduated from my secondary school, most of the graduates don't actually have that kind of vast orientation regarding the eye care thing. Majority of the individuals after we graduated, half of us want to be medical doctors, the other half want to be engineers. So then I just come to realize that everybody wants to be a medical doctor. So, in everything there is going to be like a gap. There are some slopes that are not being filled. And the community might be like actively in need of their own services. So then I come to realize that so even if I actually become a medical doctor, I would need to become an eye doctor. Because they said vision is the center of independence, productivity, and dignity. This podcast we are actually doing, if, for example, the sun enter into your eyes, it can actually affect the integrity of the podcast, isn't it?
It is correct.
Yes. And after you wake up, the first thing you actually do is open your eyes. And by you opening that eyes, it actually helps you to differentiate between are you still in the dreamland or you are awake. So one of the things people find very important is their sight. You understand? And for you to be able to make a reasonable impact, you will have to consider that valuable thing, which is the eyes. So I actually have the passion of becoming a doctor of the eye. Then I came to realize when Bayero University Kano was the only institute in the whole of the northern part offering optometry. At first, just like any other person, I don't know what optometry is. So I began my own research. What is optometry? What do optometrists do? Where do we work with others? I start Googling and looking inquiries. And after I understand how optometry is, how I will be able to gain my admission, then I start preparing towards becoming a doctor of optometry. And alhamdulillah, fortunately enough, I got admitted. And here I am to be a doctor of optometry.
So, in layman language, can you explain that technical words you use when people go for eye examination? For example, you will see 6/6, 6/36, you understand?
Yes.
So that is what you give out to patients, and a lot of them, they don't actually understand what are these numbers used for. So in layman language, can you explain this to the viewers?
So thank you very much for this question. As you know, in any healthcare facility, there is what we call the doctor's language. So that 660 or 636 is not meant for a patient. It's actually meant for the eye care professional to look for the interpretation. Just like when you come into the clinic, maybe they want to take your BMI, they will have to measure your units. What you actually do, isn't it? Then your height. So the same thing in the eye care thing. For us to know how well you can see at far or at near, we will have to measure. You understand? So the interpretation of that 660, it means any person that actually ever attended an eye examination, he will know that there is a measurement the woman used to take before measuring or examining, testing your eyes at distance. So that 6 means the distance at which the eye test is performed. While the 60 is just a reading. You understand? It's just an interpretation. It actually means that what you were able to see at 6 meters, a normal individual that has no problem with his or her eyes can recognize that letter at 60 meters. You understand? So that's the reason why if you see the visual acuity chart, you would know that the charts, that is the letters, are calibrated. The first one is bigger than the second, and the second is bigger than the third. It's keep on decreasing. So we are going to have like the 660, 636, 624. As you can see, it's actually reducing, and the size is also reducing because the clinic is not that big. You can't say you can't like take a measurement of like 60 meters. You understand? And keep the chart for you to make your measurement. You understand? So that's the reason why that chart is being created. It is the same interpretation. So when the clinician actually sees it, they will be able to interpret to know whether you are having a long sight, short sight, or any other pathological condition that can affect how well you are seeing. So that's it.
So we are actually concluding, Doctor. Do you have anything to leave us with? Some word to leave us with?
Okay, to my fellow medical practitioners like myself, what I actually want to say is that being a healthcare provider is not just a professional, it is actually a responsibility. You have to make a choice, service over status. No matter how little, if you can actually make a reasonable impact into do it. You will have to choose growth over your comfort because a lot of the time patient comes to you at your discomfortable moments, but regardless of that, you will have to solve their own problems, which is quite very important, and that is going to make reasonable changes to their lives. And to every other person out there, I would also like to say success is never accidental, but prayers is actually. Thank you very much.
Much better. And I thought at the end you will say, okay, to everyone, take care of your eyes. So thank you for having me. Thank you so much.